Okay, good morning all. We're going to start the health services meeting on this 23rd day of May. And with that, I'm going to ask Rob to come up and we're going to start with mental health. Is that all right with you, Dee? Okay, I need someone to make a motion to approve last month's minutes. Supervisor Smith, seconded by Supervisor Runyon. Any additions or corrections to the minutes? No, that's right. In favor? Aye. Opposed? Carried. Thank you. All right, Rob, it's all yours.
Hey, good morning, everyone.
Morning.
My first item here is a request to amend the 2023 Warren County budget in the amount of $104,124. And this is to allow for acceptance and pass through of 100% state aid funding that's coming from the New York State Office of Mental Health. I've attached a Schedule A to the request form there that shows the distribution between three of our contract agencies. And this funding is designated for minimum wage adjustments, some supported housing, and home-based crisis intervention services.
All right, would someone like to make a motion? Supervisor Bruno, seconded by Supervisor Runyon. Any questions for Rob? All right, we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
Okay, my second request is for a transfer of funds in the amount of $13,950, and we'd like to transfer from our salary line to retirees hospitalization. And this is to cover some anticipated costs due to retirement of our deputy director in January. It turned out in the report, one of the budget reports, that we needed to increase the retirees hospitalization line by $13,950. So that's the reason for the request. We have unspent funds right now in the salary line because we've had some delay in backfilling that position.
Great, thank you. Someone like to make the motion? Supervisor Geraci, second by Supervisor Runyon. Any questions? All right, all those in favor? Aye. Opposed? Carried. Thank you.
Then just real quick, my one informational item is that I wanted to just note that May is Mental Health Awareness Month. I appreciate the chairman signing the proclamation for Mental Health Awareness Month in Warren County. And I did provide just a little informational sheet in the packet that just highlights things about mental illness. We know that 1 in 5 U.S. adults will experience mental illness. So that's 20%. 1 in 20 will experience serious mental illness. That's 5% of the population. And when we talk about serious mental illness, it's really more the type of illness that impacts significantly on an individual's functioning. And there's some other statistics there. I won't really go through all of them, but I provide some. And then also additional handout there. I wanted to just mention that 988 has been implemented in New York and many places across the country. So they now have, instead of the National Suicide Hotline, where you had this, long number you had to remember, now you have 988. People can just call 988, get right through to the National Suicide Prevention crisis line. And the 988 is linked with our local mobile crisis. So they, can make referrals or transfer calls, basically call out our Parsons mobile crisis in situations where it's needed.
Thank you for that information. Any committee member have any questions for Rob? Any comments? No. I guess we're all set then, Rob. Thank you kindly.
Appreciate
Enjoy the rest of your day.
Yeah.
Dee?
Good morning.
Morning.
So today I just wanted to go over our annual report with you for the Office for the Aging. This was distributed earlier. So the first page just kind of gives you a summary of what's included in the report. On page 2, this gives you a breakdown of the funding that we get from the federal government. The program period for these funding streams is January 1st through December 31st. It goes through individually what the different funding streams are. Then it will give you how much we get from the federal government itself. It tells you the maximum amount, the percentage of the funding. So you'll see Title 3B supportive services. We get 90% reimbursement from the federal government. And for 2022, we had $86,115. It gives you a brief description of what can be included underneath that funding program. 2 things to note on this page: that for Title 3C, which is our nutrition program, typically the county's way overmatch in this funding or in these 2 programs. So although it says it's 90% funded by the federal government, it's actually way less than that. The county government covers way more on those 2 funding streams. Page 3 goes over the state funding programs that you would get. Again, it's the similar breakdown as to the page 2. This program period goes from April 1st to March 31st. Page 4 goes over a couple of miscellaneous funding streams that funding streams that we get in their program periods. On the very bottom, you'll see the COVID stimulus monies that we have received. It will also tell you if we've used them in 2020 or 2021. If that is not written down, then we still have that money available for us to use for 2023. The very bottom of page 4 tells you what we used in 2022. So you have a rough idea. We are hoping to use the remainder of all of our stimulus monies in 2023. So beginning in 2024, we'll kind of go back to our normal funding amounts for the county match that we normally were before COVID hit. On page 5, 6, 7, and 8, this goes over the different programs and services that we offer at the Office for the Aging in Warren and Hamilton counties. Then on pages 8, 9, 10, 11, and 12, this goes over the different contracts that we have with other agencies, and it gives a breakdown of the number of units of service that were provided underneath each of these contracts and the number of individuals that we reached with these contracts. And a unit of service can be 1 hour of information and assistance, 1 hour of personal care services, or 1 trip. So a trip to the doctor's appointment, and then that would be 1 unit, and coming back would be another unit, just as examples. Then on page 12 and 13, this kind of gives you some of the highlights of what happened last year in 2022 for the Office for the Aging. The main things that happened is we were able to do outreach programs again, where we go into the community and present to seniors and community members. We were also able to open up most of the congregate sites. So that's where the individuals can come in for meals at the meal sites throughout the counties in Warren and Hamilton County. We also entered into a memorandum of understanding with the Independent Living Center of the Hudson Valley. So they now have an individual in our office, so we can collaborate with providing information and assistance under the New York Connects program. And then with the New York State Office for the Aging, we have the Animatronic Pets program and the LEQ program that we can offer our seniors to help combat social isolation. On page 13, there are links for these 2 so that you can go online if you want to look into it and get some more information. Or if you'd like, I can also present them at a future meeting if you would like. So just let me know about that. And then on pages 14, 15, 16, and 17 and 18, it gives you a breakdown of each individual meal site. It tells you, it gives you a bar graph from 2016 up till last year, showing you how many congregate meals were served, how many home delivered meals, the amount of congregate contributions we received, and the amount of home delivered meals contributions we received. And again, that's for each individual meal site. So it kind of shows you where the monies are coming from and how many meals we're serving at each location. Then on page 19, the first graph gives you a breakdown of how many or what the contribution levels are for each individual meal site from 2016 up till last year. Kind of demonstrates whether it's gone higher or lower over the course of the years. On the bottom, it gives you an average cost per meal for 2022 for each of the individual meal sites. And then you'll notice in the brackets that it also gives you the 2021 figures, so you can compare them from one year to the next. All of the cost per meals have gone up from last year to this year. And that can be attributed to the increase in cost for foods and supplies, as well as salaries for staff, because we had that increase last year in 2022. And then that last sentence on the bottom of page 19 gives you the average cost per meal for Warren County, Hamilton County, and then for all of the meal sites together. So you can see those figures. And then on the very last page, this is the fiscal review. So this gives you the breakdown for Hamilton County and then for Warren County from 2019 up to 2022. The first set gives you the total amount of expenses by quarter for each of the counties. And then underneath that, it tells you how much the county share was for each year. And it does break it down into quarters. You'll notice that 2020, 2021, 2022, the expenses are about the same, but the county share is drastically lower for 2022 or 2020 through 2022 as compared to 2019. And this is because of all those COVID stimulus monies that we received. So the figures for 2019 under the county share. So for Hamilton County, it was $198,813. For Warren County, it was $677,357. This is where we're kind of projecting where it should be back in 2024 when we run out of all of our COVID stimulus monies. So that's kind of just the breakdown that I wanted to present to you guys, so you would have an idea of what programs we offer, what funding streams we get from the state and the federal government, and where we provide all the services.
I think that was a great report. Thank you.
Very
Any
good.
committee member have any questions regarding your
Yeah, I got a
report?
couple of questions.
Go ahead.
Back on page 12, the units on page 11 are in hours. Are the units, the PC1 units and PC2 units on page 12 also in hours?
Yes, those are in hours.
And then on page 19, can you explain a little better about the y-axis? What those numbers mean?
So it gives you, mine is not in color, your guys' should be in color, so it's a little bit easier for you to read. It tells you kind of what the average amount of contribution is per meal site. And it tells you that like for 2016, and then it goes up to 2022. So it shows you where the average was per meal, and then it will kind of either go up or down.
So those units are in.
Dollars.
Any other questions? Not, thank you very much. I think this is a very informative report, and I think we all make a point of reading it through the whole thing. That way, if we do have questions next month, we could ask. All right, thank you, Dee.
You're welcome. Thank you.
Anything else you need to fill us in on, or are we good?
We're good. I would just like to reiterate that, all of this was due to the hard work of the staff, both at the meal sites and within the office. That none of it could be accomplished without them. And then just the last thing I would like to mention is that my final 6 staff members that had to take tests, the civil service tests to become permanent, they all passed. So good. We're good to go in the office, which I'm very pleased to say.
Yeah, good. Thank you very much.
Thank you.
Have a good afternoon.
You as well.
You could be too far behind. Nell has a very short agenda.
Maybe. If it's different than what.
Changed.
I'm good.
Yeah, if it didn't change, I have it.
It didn't change.
Okay.
Mechanism.
Yep, it is not.
Yeah, I would think,
Okay.
appreciate it.
You have it. Okay. Good morning, ladies.
Morning.
You're all set whenever you're ready.
So hopefully a quick agenda for you today. Good morning. Our first resolution request and only resolution request is to authorize a contract and to accept New York State Department of Health Public Health Emergency Preparedness Grant funding in the amount of $52,099 for the grant period of July 1st, 2023 to June 30th of 2024. And to approve future amendments authorizing additional funding and extensions and authorize the Board of Supervisors chairman to sign the amendments as required. Our current grant ends June 30th of 2023. Additional funding is the same amount as last year and covers our emergency response activities. Should there be additional funding or grant year extension, authorization is needed for the Board of Supervisors chair to sign the amendments. Initially, I thought we needed a budget amendment, but because this is the same amount every year and didn't increase, we already have that budgeted, so we don't need to amend the budget. We just need to approve getting into the grant and accepting the money.
Okay, great. Supervisor Bruno made some motion, seconded by Supervisor Smith. Any questions? Now we'll vote on it then. All those in favor? Aye. Opposed? Carried. Thank you.
And we have our typical attachments for your review. Should there be any questions, you can let us know. But Ton can go over our fiscal.
Attachment 2 is our financials as of May 10th. And it will give you an idea of where we stand as of then. 22, as far as I know, is closed. So we're all set there. All of our preschool's been billed. We got those bills out and they were submitted in April. Just to note at the bottom again, that for salary, we're 21.92% of the budget right now. And last year at this time, we were 30.73. Again, keeping in mind COVID and clinics, and those are some of the things that affected. Attachment number 3 is again our comparison of this year to last year. Again, you'll see the difference in revenues, waiting for some things to catch up from last year to this year. Salaries, which I just discussed. Equipment, one thing I did want to note, part of the equipment is $133,003.80. One of the big grants that we have is the ELC school grant, where we're working with all the schools in the county. And we will see a lot more expenses between now and June, just to let you know. But in this particular case, 133,000 was for the air purifiers and filters. Contractual is pretty much the same thing with some supplies for schools, and fringe benefit is based on the salaries, and the revenues are pretty much caught up. One thing I noted is that May we started with rabies clinics. Those have been very good when we get them because we've limited them now. We don't have them spaced out. We're doing 6 for the year, and COVID clinics have been almost nothing, I guess you could say. And STD clinics, we do have those scheduled, but again, those are free and go through our state aid.
Any questions from the committee? Supervisor Smith?
So, kind of a binary question. On target, budget's on target, ahead of target, or on schedule?
Budget, overall, I guess I would say probably below budget of what we expect, especially in the home care, because we're down with referrals, we're down with nurses.
Any other questions? Thank you for that report, Ton.
And then I just wanted to bring out for meetings and conferences, which is your attachment 7, Dan Durkee and Josh Duck, our new health educator, will be attending a statewide harm reduction symposium, sharing evidence-based strategies and best practices to meet people where they are. That's going to be held in Syracuse, June 14th to 15th. And NYSHO is sponsoring both of our staff. So we only have to pay gas and tolls and possibly a few meals, but otherwise all other expenses are covered.
Oh, very good.
And that's all I have for today.
Thank you. Committee members, any questions for Gina? No. I didn't do this before, privilege of the floor and public comment. Is there anyone in the audience that has a question for the department? Not? Yes, Janelle.
I would just like to take this time to thank you as our chair and thank our committee and thank our fellow departments and the administration over the last 3 years for their support for COVID. I know COVID has affected everybody, no matter what walk of life you're in. I know it's affected people in all communities. It's affected working people, non-working people. It's affected basically everybody, especially in healthcare. I just, from the bottom of my heart, want to say thank you. And also to our community, because I thought our Warren County community members were awesome in following our recommendations and listening and heeding our advice. And I also want to do a shout out for our medical director, Dr. Bill Borges. He was always available when we needed that extra guidance or extra support. But I just want to say thank you. I know it's technically not over, but the emergency order part is, so no mask, yay. And just, we are still following up on cases that get reported to our office, in part because we still have funding, but probably the more important part is just if somebody's hospitalized or trying to identify vulnerable situations so that we can provide any support that we need. But I want to thank you, Supervisor Frazier, for
You're welcome. Thank you for the
support.
kind words, but we know how much we need to thank the health department for everything they do here. That's true. I know the untold hours that they worked when I would get a call at 6 o'clock on a Sunday night, thinking she should be home having dinner, and she's calling to kind of touch base on something. So just so you know, we certainly do appreciate all that your department did during those past 3 years. So thank you, Janelle. Thank you, John. Yes, go ahead.
Thank you, Chairman. Janelle, I would really personally like to reach out, as long as our chairwoman just did, is to really thank you and your department, because that wouldn't have been possible if it wasn't for all you dedicated and hardworking. And you really are a rock star in what you do. You have a great disposition with you. You're a hard worker, and you have a great team that stands under, and I respect you also. But so this wouldn't have happened if it wasn't for all your hard work. So thank you and your team.
Thank you. I'll pass
Brad,
that
thank
on.
you for those words. That was very nice of you. All right, with that, I guess I'll entertain a motion to adjourn. Supervisor Bruno, Supervisor Stitt, all those in favor?
All right.
Bye.